Dr. Erin Riley, who is a licensed clinical research psychologist at the VA Bedford Healthcare System. She is the co-director for the VISN-1 Mental Illness Research Education and Clinical Center, or MIREC, assistant professor of psychiatry at the University of Massachusetts Chon Medical School, and a co-investigator with the VA Virtual Care Consortium of Research, or VC-Core. So thankfully, Erin is also just a really cool person that we have gotten to meet over the past year, who is helping us evaluate one of our many national immersive technology pilots. But we are very grateful for her support and her expertise. So please welcome Erin.
Hi, welcome. Can you all hear me? Okay. If you can't at any point in time, feel free to start making this move. So I'm very excited to speak today. As Caitlin so kindly said, I am a clinical research psychologist, which means that I'm a licensed psychologist, but I also really adhere to the scientist practitioner model. I also started my work really in educational technology. And so while I was getting my psychology PhD, I was working on massive open online courses, lecture capture, and thinking about the ways in which we can really assess these things. And so I've been very happy to hear a lot of the themes that I'll be talking about today coming up in people's prior work, especially around the importance of thinking about not just evidence-based for VR, but evidence-backed. And so I've titled my talk, Escaping Reality or Reconnecting with It, the VR story, because I think it's really important that we are coming at this work with a lens of optimism yet skepticism, and really thinking about the ways in which the stereotypes around VR may or may not be backed by the actual data that's coming in. I'm going to argue that maybe it isn't. So I've been lucky enough to work with Caitlin and Anne as their researcher in residence through the Health Systems Research Group for the REAR. And so I've been working primarily on the targeted mental health pilot for virtual reality for chronic pain and suicide prevention. And if you are or are not with the VA, you are probably very well aware of the fact that chronic pain and suicide prevention are major priority areas. Veterans are often much more likely to experience chronic pain than non-veterans, about anywhere from 40 to 56% at any point in time. And the severity of the pain is often much more in our veteran population. In terms of thinking about what chronic pain actually looks like in our population, I'm a psychologist, so I do a lot of research on dual diagnosis. That's what our VISN-1 MIREC is really primarily about, which is addiction and comorbid psychiatric conditions. And what we see in chronic pain is very rarely you're just experiencing chronic pain, right? The chronification of pain, or moving from acute pain to chronic pain, involves a lot of different processes that can lead to increased depression, lower functioning, and of course, unfortunately, suicidal ideation. And so what we have been noticing in the technology research world is that there are a lot of opportunities for technology to help veterans get the care they need where healthcare happens, which is not just in the hospital, but in their home. And so the Penumbra RealX series pilot did this amazing work that when I started at the VA in 2016, I would have been through the roof to do this work, of getting VR systems onto 60 different sites, 300 VR systems deployed throughout the nation starting in 2022. And the work that's being done in this is not just, of course, getting the headsets into the hands or onto the heads of veterans, but also really engaging providers with this system, because as has been mentioned before, if it's not in the workflow, if it's not easy to use, if it's not clear how to use it with patients, it's not going to get used. And so, did that do it? Aha. So let's talk a little bit about the pilot. So many of you might have seen the Penumbra RealX series. It is fully immersive experience, visual, audio, and additional content is being developed as well. People like Skip and Billy have already talked about this today and yesterday. But the original environments that were being used were for relaxation, mindfulness, travel, breathing, and encounters, or the exposure treatments. And so really thinking about how this can be leveraged for chronic pain and mental health is just so imperative, but these are 5 very broad areas that we see across other platforms, not just VR, that are being asked for by our veterans. So let's talk a little bit. I'm not going to throw a bunch of numbers at you, as I would love to, but 15 minutes. So let's talk a little bit about what we're seeing from the preliminary results. So this is extremely encouraging. As a psychologist, knowing that this, a quick 3, 5, 10-minute experience could lead to these kind of outcomes is excellent, especially when you're thinking about what it means for our patients to come in and do more work with us, right? Can we use VR in a way that helps them to engage in the work from a different perspective? We use this metaphor often of calming the waves of the storm for a boat so that you can actually continue on your journey, calming the waves using VR, right? And getting these kind of reductions in anxiety, pain intensity, and self-reported distress, or the SUDS, is just incredible, but also it made us want to look deeper. We're getting this data and we're thinking, okay, so what are they doing? And kudos to the team for actually collecting this data as part of a demonstration pilot, because it's just so wonderful to have this kind of evidence now. So what we saw from providers, because there were provider surveys and there were veteran surveys to provide feedback. What we saw was that providers were prescribing, as has been discussed, but VR environments in collaboration with veterans that were really kind of clinically indicated in terms of thinking about those reductions in symptoms, that kind of more useful experience to allow them to feel some relief from pain or mental health issues. So we saw a lot of the relax encounters and the mindfulness encounters were being deployed. Also some travel. And this also meted out in the veteran responses, where they were really talking about how the VR systems allowed them to feel less stressed, feel more relaxed, to notice that their pain was lower. So all excellent things triangulated together. But then we were surprised a little bit. What are veterans reporting that they're choosing in their feedback surveys? Well, they're choosing relax and mindfulness, but they're choosing travel. So the travel piece, there were these environments that would get them out into nature, get them into different experiences. What might be going on there? I'm going to argue, looking at the data, and I think this goes along quite well with what other people have been talking about, that what we're seeing is that using VR can absolutely support symptom improvement. I'm a scientist, a psychologist. I like symptom reduction, but I'm also an acceptance and commitment therapist. If anyone knows ACT, they know one of our things is, and seeing nodding, symptom reduction is not enough. We care about functional improvement. We care about what's called value-based living. And so I'm going to pull a little theory in. I can't help it. So this is Snyder's hope theory, really. And this is a Norman Cousins quote. The capacity for hope is the most significant fact of life. It provides human beings with a sense of destination and the energy to get started. And this actually came out yesterday in the veteran panel that it was discussed the importance of hope, and other people have talked about it too. This is really where I start seeing this sense of pushing back against the common narrative that using VR is going to be leading to escapism. It's going to be leading to disconnection from the real world. It's going to be leading to people isolating and not leaving their homes. Because what we're actually seeing is that it's helping people calm the waters, notice things that are going on that they care about, or start making goals that relate to a sense of hope. And hope is one of the most important things when we think about mental health, functioning, and suicide prevention, right? Future-oriented expectancies cannot be overstated as a positive. When we think about suicide frameworks, we think about mental health, really that future orientation, that optimism, that hope can be supported by VR if it's done well and it's either with clinicians or with excellent guidance and good encounters too. And so we've seen this a lot in the literature. It goes without saying almost that hope is a protective factor against suicide. But it's especially important for people who are managing chronic pain and depression and suicidal ideation, because when you think about what it means to shrink your world, it also means that you sort of shrink your own expectancies about what you can do in the world, who cares about you, what your connections are. And so the more that we can use VR to push against that is, I think, an incredible net positive. So I got about 2 minutes left. So I'll use it to, of course, talk about some of the open-ended feedback that we were receiving. So this is provider feedback. And it really meted out this piece around hope and connection and thinking about the ways in which they were seeing their own patients and hearing them say things that led them to thinking, this is actually helping with goal-oriented behavior. This is helping with finding value-based living possibilities. And so I'm just going to read 2 quick ones that I really loved. So being able to use the VR headset has sparked conversations about past travel and/or activities that veterans have enjoyed and would like to incorporate into their daily routine, even in modified ways, which is excellent because, again, it's about really thinking about the pathways to being functional and how that works in your life, right? And part of that is what you see, you can imagine, you can do. The second one that I loved is, it also allows for veterans to share about places they have traveled, lived, that were positive. Recently had one veteran who had been in Forest Service utilize one of the forest locations, which brought him to tears as he began to name what he was seeing, and also made him realize that he would like to go to his favorite waterfall again this year with his nephew. So thinking about how this technology isn't just immersive, it actually could be a socially assistive technology. When we think of socially assistive technologies, that means technologies that you form a relationship with and that then help you form relationships beyond that technology. And a lot of people don't see VR like that, but I think this kind of data is showing it's possible. And then, of course, veteran feedback. We got a lot of veteran feedback around this. This is just a couple of examples. I really liked the feeling that you were out there in it and that experience. It reminded me of how I was in the Forest Service. I realized I need to get back out there. It really did relax me. Another person talking about feeling like they might now want to take a trip with their wife. And then finally, one that is near and dear to my heart is a psychologist who works with a lot of veterans with PTSD and suicidal ideation. The animals and nature scenes, they're very calming to me. I suffer from severe PTSD and SI. I found this helped my motivation to be out in nature more. Knowing it helps my mood, I'd like to do this more. So if I could leave you with anything, it would be that VR has an opportunity not just to help with symptom reduction or symptom management, but also to help in the ways that we really care about as psychologists, as clinicians, as staff, as other veterans, which is inspiring hope and healing. So reminding veterans of things they've loved in the past, creating opportunities for them to reminisce with each other in group settings, which came up as well, with their providers or with other family members. And then actually potentially motivating them for future values-oriented living and activities that they care about. That's it. I think I did it. 16 minutes. All right.